What is the most important step a home health aide should take before transferring a patient from bed to wheelchair? A. Position the wheelchair near the bed. B. Put a blanket on the patient's lap. C. Tell the patient where they are going. D. Lock the wheels of the wheelchair. Answer: D. Locking the wheels of the wheelchair is crucial to ensure the chair does not move during transfer, which helps prevent falls or injuries to both the patient and the aide. This is a key safety procedure before any patient transfer. Which of the following best describes a proper hand-washing technique for a home health aide? A. Use hot water and scrub for 10 seconds. B. Wash hands only when visibly dirty. C. Rub hands together with soap for at least 20 seconds. D. Dry hands using a reusable towel. Answer: C. Proper hand washing involves rubbing hands with soap and water for at least 20 seconds. This helps remove pathogens and prevent the spread of infection. Hot water and reusable towels may harbor bacteria and are not recommended. What should the home health aide do if a client begins to choke while eating but is still coughing and able to speak? A. Perform abdominal thrusts immediately. B. Call 911. C. Encourage the client to keep coughing. D. Give the client a glass of water. Answer: C. If the client is coughing and can speak, it means the airway is not fully blocked. The aide should encourage coughing, which is the body's natural way of expelling an obstruction. Abdominal thrusts are only used if the client can't breathe or speak. When assisting a client with partial paralysis in dressing, what part of the body should the aide dress first? A. The stronger side. B. The side closest to the aide. C. The weaker side. D. The legs. Answer: C. When dressing a client with paralysis or weakness, the aide should dress the weaker side first to reduce strain and discomfort. The stronger side can assist with movement later in the process. Which of the following tasks is not typically within the scope of a home health aide's duties? A. Helping with bathing and grooming. B. Administering medication. C. Assisting with ambulation. D. Monitoring vital signs. Answer: B. Administering medications is a medical procedure that must be performed by licensed nurses or doctors. Home health aides may monitor vital signs and assist with personal care, but medication is outside their scope of practice. What is the first step if a client falls while walking with a home health aide? A. Help the client up immediately. B. Check for breathing and consciousness. C. Call the family. D. Leave the client to call for help. Answer: B. Safety is the top priority. The aide must first assess the client's condition, especially for consciousness, breathing, or injury. Moving the client prematurely could worsen any injuries. How should a home health aide record the client's intake and output? A. Estimate based on visual observation. B. Use exact measurements and document them. C. Ask the client at the end of the day. D. Only measure solid food, not liquids. Answer: B. Accurate documentation using exact measurements is crucial for monitoring a client's health. Both solid and liquid intake and output must be recorded to track hydration and kidney function. A client with dementia becomes agitated during a bath. What should the aide do first? A. Restrain the client. B. Speak in a calm and reassuring tone. C. Finish the bath quickly. D. Call the nurse. Answer: B. Speaking calmly helps reduce agitation in dementia patients. Using a gentle tone can ease fear or confusion. Restraints or rushing may worsen the situation, and the nurse can be contacted after de-escalation if needed. Which is the best way for a home health aide to prevent pressure ulcers in a bedbound client? A. Apply lotion once daily. B. Reposition the client every 2 hours. C. Encourage daily exercise. D. Use scented powders. Answer B. Repositioning the client at least every 2 hours improves blood flow and prevents skin breakdown. Pressure ulcers develop from prolonged pressure, especially on bony areas, which repositioning helps to avoid. What should a home health aide do if they notice a new open wound on a client's foot? A. Apply antibiotic cream. B. Cover it with a bandage. C. Document and report it to the supervisor or nurse. D. Ignore it if the client says it's not painful. Answer C. Any new wounds must be reported and documented. Treatment decisions must be made by a licensed nurse or physician. Applying medications or covering without direction is beyond the aide's role. A client tells the home health aide that they are feeling very sad and don't want to eat. What is the aide's best response? A. Ignore the statement and change the topic. B. Encourage the client to talk more about their feelings. C. Force the client to eat anyway. D. Tell them everyone gets sad sometimes. Answer B. Emotional support is part of holistic care. Encouraging the client to talk helps identify depression or other mental health needs, which should then be reported to the supervisor or nurse. When making an occupied bed, which of the following should be done first? A. Remove all sheets at once. B. Roll the client to one side of the bed. C. Ask the client to stand up. D. Move the bed to its lowest position. Answer B. Rolling the client to one side allows the aide to remove and replace bedding on one side at a time without causing discomfort or injury. It's a safe and standard method in occupied bed changes. What is the proper method to remove dirty gloves? A. Pull off both gloves simultaneously. B. Peel one glove off and hold it in the other gloved hand. C. Shake hands to remove them. D. Use a tissue to grab the gloves. Answer B. The first glove is peeled off and held in the gloved hand. Then the second glove is removed by sliding fingers under the cuff to avoid skin contact. This prevents contamination. Which of the following is considered a sign of elder abuse? A. A client refusing to eat. B. Bruises in various stages of healing. C. Frequent coughing. D. Forgetting names. Answer B. Unexplained bruises, especially in various healing stages, are classic signs of physical abuse. Aides must report any suspicions of abuse according to their agency's policy. Which action demonstrates respecting a client's right to privacy? A. Entering the bathroom to help without asking. B. Discussing the client's care with a friend. C. Closing the door before providing care. D. Reading the client's mail. Answer C. Closing doors or curtains before care respects the client's privacy. Entering without permission or discussing personal information is a violation of confidentiality. When should a home health aide report changes in a client's condition? A. At the end of the week. B. Only if the client asks. C. Immediately. D. At the next scheduled visit. Answer C. Immediate reporting ensures quick medical intervention if needed. Delaying may cause a minor issue to become serious, jeopardizing the client's health. A home health aide finds a client lying on the floor. What is the aide's priority? A. Help them stand up quickly. B. Leave the house to find help. C. Check for breathing and injuries. D. Clean the area. Answer C. Safety and health assessment come first. Checking for breathing and injury determines if emergency services are needed before any other action. Which body system is directly monitored when taking a client's respiratory rate? A. Circulatory. B. Digestive. C. Respiratory. D. Nervous. Answer: C. Respiratory rate directly reflects the functioning of the respiratory system, including the lungs and airways. It's a vital sign for detecting breathing problems or distress. What is the best response if a client asks the aide about their medical diagnosis? A. Give them an opinion. B. Refer them to the nurse or doctor. C. Tell them to look it up online. D. Guess based on symptoms. Answer: B. Aides must never provide diagnoses or opinions. This is the role of medical professionals. Providing incorrect or speculative information can lead to confusion or harm. What should the aide do when a client refuses personal care assistance? A. Force the client to accept care. B. Skip the task and move on. C. Respect their choice and report it. D. Call 911. Answer: C. Clients have the right to refuse care. The aide must respect this and document/report the refusal to the nurse or supervisor for further guidance. What is the main purpose of using a gait belt when assisting a client to walk? A. To carry the client's weight completely. B. To provide support and stability during ambulation. C. To make the client walk faster. D. To secure medical equipment. Answer: B. A gait belt helps the home health aide provide support and stability while the client walks. It reduces the risk of falls and allows the aide to assist without pulling on the client's arms or body. A client has a do not resuscitate (DNR) order. If the client stops breathing, what should the aide do? A. Begin CPR immediately. B. Call the family and ask what to do. C. Respect the DNR and notify the nurse or emergency services. D. Wait to see if the client starts breathing again. Answer: C. A DNR order is a legal instruction to withhold CPR if breathing or heart stops. The aide must respect it, avoid resuscitation efforts, and notify the appropriate healthcare personnel. How should a home health aide position a client who is experiencing shortness of breath? A. Supine with legs elevated. B. Lying flat on their back. C. In Fowler's or semi-Fowler's position. D. Prone position. Answer: C. Fowler's or semi-Fowler's position, sitting up partially or fully, promotes better lung expansion and helps ease breathing. Lying flat can worsen shortness of breath. Which of the following could indicate signs of dehydration in a client? A. Moist skin and frequent urination. B. Confusion, dry mouth, and dark urine. C. Increased energy and appetite. D. Low blood pressure and steady weight. Answer: B. Dehydration symptoms include dry mouth, confusion, dark urine, and dizziness. These should be reported immediately as they can lead to serious complications, especially in elderly clients. Why is it important for a home health aide to rotate a bedridden client's position every 2 hours? A. To entertain the client. B. To reduce boredom. C. To improve digestion. D. To prevent pressure sores and promote circulation. Answer: D. Regularly changing a client's position helps relieve pressure on the skin and improve circulation, reducing the risk of pressure ulcers and related infections.